It all has happened so quickly that I think I'm still trying to process.
Jeff, who asked us not to share his last name in fear of retaliation, was a contracted employee with the Maine CDC who was scheduled to work through July of 2026. His team of about 50 people worked on collecting data and tracking infectious diseases here in Maine. All of them returning their computers to the state today, now out of a job.
It does put us in a bit of jeopardy in the future should another pandemic happen.
The Federal Health and Human Services Department terminated $11.2 billion of COVID-era grants, which cut $91 million of funding for Maine. In a statement, HHS wrote, quote, "The COVID-19 pandemic is over and HHS will no longer waste billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago." But Matt Wellington with the Maine Public Health Association says that money was also used for tracking and containing other diseases.
It's hard to predict how much this will ripple into our communities and have an impact. And what often happens is we don't know what those impacts are until it's too late.
The slashed grant money was appropriated by Congress, and like many other sweeping federal cuts, terminated employees expect the issue to go to court. But for people like Jeff, it leaves a big question mark around his livelihood.
This may play out in the courts for years.
A spokesperson for Maine DHHS says the agency is still working to determine exactly what these cuts mean for Maine, but she says this will impact dozens of contracts with vendors across the state. In Portland, Anna Kuhn, CBS 13 News.